Hello and welcome to another episode of In Just 1 Minute or So. Today's topic is diabetes. Let's dive in. What is diabetes? Diabetes is a persistent health condition that impacts the way your body converts food into energy. The majority of the food you consume is broken down into sugar, that is glucose, which is then released into your bloodstream. When blood sugar levels rise, the pancreas releases insulin, acting as a key to allow the sugar into your body cell for energy utilization. In cases of diabetes, the body either produces insufficient insulin or fails to use it effectively. This leads to an excess of blood sugar in your bloodstream, potentially resulting in a severe health issue like heart disease or vision impairment or even kidney disease over time. Types of diabetes. So the first type is type 1, results from an autoimmune reaction preventing insulin production. It constitutes around 5 to 10% of diabetes cases and requires daily insulin intake for survival. The type 2 diabetes occurs when the body cannot effectively use insulin. This affects 90 to 95% of the diabetes cases. Lifestyle changes such as weight loss, healthy eating, and physical activity can prevent or delay its onset. What are some of the symptoms that you may experiment when you have type 1 or type 2 diabetes? Well, one of them is feeling more thirsty than usual, urinating often, losing weight without trying, and even the presence of ketones in the urine. So ketones are a byproduct of the breakdown of your muscle and fat, and that only happens when there's not enough insulin available to you. Also, you may be feeling tired and weak, or irritable, or having even other mood changes. Having a blurred vision, also having slow healing sores, and getting lots of infections such as gum, skin, and vaginal infections. And there's also a third type which occurs for pregnant women, gestational diabetes, which develops in pregnancy without a previous diabetes diagnosis and potentially increasing the health risk of the baby. It usually resolves after the childbirth, but it does raises the mother's risk to develop type 2 diabetes later in life. Let's talk about some statistics. So according to the World Health Organization, 1 in 10 adults worldwide have diabetes, and in most cases, 90 to 95% have type 2 diabetes, which can be prevented or at least delayed through behavioral and lifestyle changes. Let's look now in Canada. So in the years leading up to the pandemic, 2016 to 2019, almost 1 in 10 Canadian adults aged from 20 years old to 79 years old had diabetes. Now, the prevalence of diabetes ranged from 1% of Canadians aged 20 to 39 to almost 1 in 5 seniors aged 60 to 79. This is, of course, according to the Canadian Health Measures Services. Now, if we look in the US, approximately 38 million US adults have diabetes, with 1 in 5 being unaware of the condition. Diabetes ranks as the 8th leading cause also in that country, and it is a primary cause of kidney failure, lower limb amputations, and adult blindness as well. Over the past 2 decades, the number of adults diagnosed with diabetes has more than doubled. So what triggers diabetes? Diabetes is primarily caused by an excess of glucose in the bloodstream, right? Regardless of the diabetes you have, the type I mean. However, the underlying reasons for elevated blood glucose levels vary. That is what makes the type 1 or type 2 that we were talking about. So let's look at some of them. One of the reasons is insulin resistance. That's the main factor behind the type 2, where the cells in the muscles, the fat, and the liver fail to respond adequately to your insulin. So, various elements contribute to varying degrees of insulin resistance. That includes obesity, insufficient physical activity, dietary habits, hormonal imbalances, genetic predisposition, and specific medications. Another reason is the autoimmune disease. This is type 1 diabetes and another one called latent autoimmune diabetes in adults, or LADA. This occurs then when the immune system targets and attacks the insulin producing cells in the pancreas. Another of the reasons is hormonal imbalance. So during pregnancy, hormones released by the placenta can induce insulin resistance. If the pancreas cannot generate sufficient insulin to overcome this resistance, then gestational diabetes may develop. Other conditions that are related to these hormonal imbalances are acromegaly and also the Cushing syndrome. Acromegaly is a rare condition where the body produces too much growth hormone, causing both the tissues and the bones to grow more quickly than expected. And over time, this leads to abnormal large hands and feet and a wide range of other symptoms. The other one that we mentioned is Cushing syndrome. This one happens when the body has too much of the hormone cortisol for a long time. So these two can produce as well type 2 diabetes. Another reason still is pancreatic damage. The physical harm to the pancreas stemming from a medical condition like a surgery or injury anyways can impair its ability to produce insulin, and that leads to a called type 3C diabetes. And we talk about genetic mutations as well, because the specific genetic mutations can be responsible for causing a maturity onset diabetes of the young, the MODY, and a neonatal diabetes. So what are some of the complications of long-term diabetes? The elevated blood glucose persisting for a very extended period of time definitely will inflict damage on the tissues and the organs of your body, especially those that affect the blood vessels in the nerves. So the most common complications associated with diabetes involves cardiovascular issues, especially the heart. So you can expect coronary artery disease, heart attack, strokes, or atherosclerosis. Additional complications could be nerve damage, that is called neuropathy. This is characterized by numbness, tingling, and other pains. Nephropathy, which actually results in kidney failure, and therefore you would need dialysis or a transplant. Retinopathy, that is related to the eyes, and potentially you're facing blindness. Other possible complications are foot conditions like diabetes affecting your feet, the skin infections, amputations, sexual dysfunction as well, for both sexes, I mean, and gastroparesis. What is that? Well, it's a disorder that actually slows or stops even the movement of food in your stomach, or from your stomach to your small intestine, and it's kind of very strange because there is no blockage there. It just decides to stop moving. Another complication could be hearing loss or oral health issues like, for instance, periodontal disease, gum disease in your mouth. So living with diabetes can also have an impact in your mental health, because when we get diagnosed with that, It's really makes us go through a very, implementing radical changes, but some people also experience depression. It does impact a lot the mental state. And while there is no currently cure for diabetes, the best option is to adopt a healthy lifestyle, lose that weight that is overweight, of course, consuming nutritious food, and engaging in physical activity to alleviate any impact of this disease. And obviously, always following what was prescribed as medications, seeking to educate yourself in diabetes, self management, and getting the support that you need, and getting for sure checked regularly with your doctor. And that's the end of the current episode. Thank you so much for being there, and looking forward to seeing you in the next episode.